minute or so. So let's just give it another minute while people are still trickling in.
Sounds great.
Welcome to those of us joining us right now. You're in session B at the 2 o'clock hour, and this session is going to be covering the health coverage, balancing benefits, access, and coordination for Native youth in foster care. My name is Kelly Linscott, and I'm with the Office of Tribal Relations with DCYF. And we have 3 teams that are presenting today. We have a team from Coordinated Care, a team from Washington State Healthcare Authority, and also from the Department of Social and Health Services. This team, as I mentioned, will be presenting on health coverage and benefits. We will have a few minutes for questions at the end of the session. Please limit your chat activity to questions sent directly to myself. I'll be monitoring. I'm the room host this afternoon. I'm going to go ahead and hand it over. Katie looks ready. So I think we'll hand it over to Katie and let the teams introduce themselves. Thank you, everybody.
Just a quick technology check. Are you all now seeing kind of our intro slide? Health
Yes,
coverage.
I'm seeing it.
Okay, then I'll turn it to you, Raina. Go ahead.
Okay, great. Well, hello, everyone. Thank you so much for joining our session today. Kelly, you did a great introduction. Actually, our session topic is healthcare coverage, balancing benefits, access, and coordination for Native youth in foster care. The representative people who will be sharing information today is from the Washington State Healthcare Authority, the Washington State Department of Social and Health Services, and Coordinated Care of Washington. Next slide, please. Tribal land acknowledgement. Before we start our meeting today, we acknowledge that we are meeting virtually throughout Washington State on the traditional territories of hundreds of indigenous nations, with many areas covered by treaties that were signed between the United States and tribes under duress before Washington State was even a state. I am joining from the east side of Washington State on the Spokane Indian Reservation. In our Salish language, Spokane is pronounced Spokane, meaning children of the sun, reflecting our deep connection to the land and traditional lifestyle. I honor and thank my Spokane and Colville ancestors and leaders who are stewards of these lands. My family was raised as hunters, fishers, and berry pickers. We learned the importance of nurturing our land and the animals within. I commit to continue to care for my ancestral lands, the water, and our animal brothers and sisters. I commit to advocating for the importance of living in balance, uplifting the sacred bond between the health of the land and the health of the people. In addition, Chapter 43 requires state agencies to work with tribal governments throughout the state in government-to-government partnership. As state employees and contractors, we have an obligation to ensure our land acknowledgements are accompanied by an action and integrity in this space, and that we are committed to improving systems and services for tribal people. Thank you, Katie. Next slide, please.
Good afternoon, everyone. We are happy to have this time and this space to share and engage thoughtfully about our intentional partnerships with DSHS, HCA, Coordinated Care, DCYF, and our Native nations to build meaningful relationships to support our tribal children in out-of-home placement. As we start our time together, we think it's important to open in a good way with sharing some words that we resonate with, from lifting hearts off the ground, declaring Indigenous rights and poetry from the United Nations Declaration on the Rights of Indigenous Peoples. As we move into this new, beautiful fall season, it's a good time to remind ourselves to pause and take in the changes the new season brings us and the beauty all around us as we navigate through these unprecedented times that we do find ourselves in. I see beauty in movement, trees pulsating in the whisper of the breeze that trails the swaying grass. I see beauty in the movement of creation, yet to my dismay, I can remain unmoved by humanity. I rarely celebrate the rights that are the foundations of my comfort. Why do I struggle to grasp beauty everywhere, in everyone? We're here to share a lot of information today, So I'd like to share another short poem with you that also resonates. Witness the beauty of language as it widens the circle of understanding to include knowledge of self and community, land, and life. Thank you so much for sharing your time with us today. Next slide, please.
Thank you again for joining with us today. We are going to spend this moment to share our introduction. So we'll begin from left to right. If my peers can join us on CAN, we'll start with Rena.
All right. Hello, everybody. Thank you so much for allowing me to share with you today. My name is Rena Pione. I'm a member of the Spokane Tribe of Indians. I live and work here in Eastern Washington, and I'm honored to serve the tribal people and communities that I care so much about. I'm a member of the Office of Tribal Affairs team with the Washington State Healthcare Authority, and we support tribes and urban Indian health providers across Washington State. Thank you.
We'll
Good
go
afternoon,
to
everybody. My name is Jaron Heller, and I am the South Sound Regional Tribal Liaison from the Healthcare Authority's Office of Tribal Affairs, and I am a descendant of the Steilacoom tribe. And I will pass it over to Jennifer.
Jennifer, we're having trouble hearing you. I'm not sure if you're having some difficulty, but let's move on to Kaiser and then we'll come back to you, Jennifer.
Corcoran, and I'm a program specialist with DSH's Fostering Wellbeing Program. I have a great passion for the foster care population, as my family was so lucky to have my brother join our family through foster care and then adoption. And Fostering Wellbeing has given me the opportunity to work with foster children, caregivers, and caseworkers and assist them with accessing quality healthcare that is also culturally meaningful.
Thank you, Kaiser. And good afternoon, everyone. Yate. My name is Twyla Malari. I'm Director of Tribal Relations for Coordinated Care. I'm joining you today virtually from the traditional lands of the Duwamish people, and I'll be supporting throughout today through comments, through the chat box, and also helping support with facilitation. Thank you. I'll turn it over to my colleague, Katie.
Thank you, Twyla. Hi, everyone. My name is Katie Ferguson. I use she, her pronouns. I am the program manager for Apple Health Core Connections at Coordinated Care. I am a second generation Italian American through my father, and I am an Irish German through my mother. And I'm happy to be here with you all today, coming from, I'm sitting currently on the traditional lands of the Muckleshoot in the greater Seattle area. And Jennifer, we just want to give you one more chance if you are able to see if your audio is coming back. We heard you great originally, so hoping we can hear you again.
Okay, can you hear me now? Yes?
Yes, we can hear you.
Okay, good. I'm Jennifer Heeb. I'm a program specialist or a program specialist with DSH's Fostering Wellbeing Program. And since the beginning of my career as a school counselor, my heart really has always been with children and youth. As a district medically fragile student liaison, I've worked with parents and foster parents, tribal caseworkers, in supporting them and their children. And it really brings me so much joy to come full circle, bringing my mental health and the child development background to fostering well-being, and to now provide support services for you and your tribal children through integrated care coordination. And that's it.
Thank you. Next slide, please. Again, we welcome you today in this shared space, and thank you to everyone who introduced themselves and your time today. Throughout the presentation, we encourage but do not require cameras on, but we do encourage it. If you're able to share your faces, that is also appreciated. If you may remain on mute to reduce any background noise, we'd appreciate it. We do welcome questions throughout the presentation in the comment box until the very end. So if you have any questions, I'll capture those and support with facilitation at the end of the presentation. But if we may hold verbal questions till the end, that's appreciated. You're also welcome to take a step away, just reminding ourselves to take care of ourselves today, and taking a break, look away from the computer if needed, or get rest if you need to do so throughout the presentation. For our time, we are going to review shared understanding of the language that we'll be using today. So please forgive us and grace in all of the acronyms that may come up, but we'll try to ground ourselves and align in the language. Again, we'll review access to healthcare coverage for youth and foster care. We'll cover Apple Health without managed care, so the fee-for-service option. Behavioral health services only overview, care coordination options and how to access us at care coordination, and Apple Health Core Connections, an overview of our program there. So with that, next slide, please. So we'll start with shared understanding here, and I'll turn it over to our presenter on this slide. Again, welcome any questions in the chat box, and you can also keep eyes there because we'll be posting links throughout the presentation. Thank you.
All right, so I'm not going to cover everything on this list, but one thing that we do want to start with is that there are no standard criteria for determining who meets the definition of an Indian or an American Indian Alaska Native person. Many federal programs and laws use a definition that includes only members of federally recognized tribes, but some individuals who identify as American Indian Alaska Native could be members of one of the 574 federally recognized tribes, but others may be members of state recognized tribes or not enrolled in a tribe at all. For our purposes here today, with Medicaid and the State Children's Health Insurance Program, the definition generally includes individuals who are eligible to receive services from an Indian healthcare provider, meaning an IHS or tribal provider, or an urban Indian organization. These eligibility criteria are related, but not strictly tied to tribal membership. However, ICWA, the definition is any unmarried person who is under age 18 and either a member or citizen of an Indian tribe, or is eligible for membership or citizenship in an Indian tribe, and is the biological child of a member or citizen of an Indian tribe. So, we're going to get off on the right foot here with a lot of acronyms, a lot of complicated language. So please do stop us if you need us to explain a little bit further on anything. And with that, I will turn it over to Raina, and next slide, please.
All right, thank you, Jaren. So this slide is a nice visual that looks at the very complex healthcare delivery system, especially when you're working with tribes. So on the left-hand side, you can see funding sources by priority. So what this is this is the payer. When a person goes in for care and services, we're looking at the from top to bottom of who the primary payer is. So looking at on the left-hand side, the commercial insurance. So someone goes in for care and then we look to do the billing. The first person the first agency we're looking at is the commercial insurance. So that's going to be your MCOs. From there, we drop down to Medicare. After that, Medicaid. And down below, we're then getting into Indian healthcare services. And then payer of last resort could be the person's tribe, their tribal government. So sometimes there's a misconception that because folks are tribal, that the tribes are the first payers that cover their services. So that's not true. So this is the payers by priority. And then looking over to the middle of the slide, you can see Indian healthcare facilities by type. So there's 3 different types of healthcare facilities. On the left, you see the federal facilities. That's going to be your federally operated Indian healthcare clinics. In the middle, you see tribal health facilities. Those are healthcare facilities that are owned and operated by the tribes themselves. And then in the green, you can see the urban Indian organizations. There's two primary medical healthcare organizations in the state. On the west side, you have Seattle Indian Health Board. And on the east side, you have Native Project in Spokane, Washington. They're the largest providers of the tribal urban populations in the state. Further on in this healthcare facilities by type, this is changing actually. So within this year, there have been 3 IHS medical care clinics operating within the state, one in Yakima, one in Colville, and one on the Spokane Indian Reservation. That's changing. So the Spokane and Colville tribes have moved forward to own and operate their own programs, physical medical care programs, as well as behavioral health. So pretty much when we do this update next, there'll be one IHS service unit continue to operate in Washington. That's in Yakima. Yeah, and the rest are tribally owned and operated healthcare facilities. Next slide, please. Tribal services. So it's important to remember that each tribe determines who they serve. Eligibility and services related to that eligibility are very different. And if you know one tribe, you know one tribe. So you have to work with that tribe individually to find out what services that tribe offers, supports, and who may be eligible to receive services. So also remember that eligibility may differ between physical health, mental health, substance use, etc. Provide additional services, or they may choose not to bill MCOs. So tribes can do their own services that are unrelated to MCOs and or Medicaid billing, such as diabetes, asthma, immunizations, and mental health services. Influence AIAN choice between fee-for-service, BHO, or MCO enrollment. So just remember that when you're working with a AIAN person, that they have the ability to remain in fee-for-service. We understand that some services are highly connected to an MCO, such as maybe residential care. They like to work with a certain MCO over fee-for-service, although it's important to not pressure anyone from changing from their fee-for-service primary care choice or to enter an MCO or a different tribal health coverage service. And just remember that every tribe is organized differently, and that tribes have a IHS, their funding, annual funding agreements. And this is an agreement with Indian Health Services, but tribes can go beyond what services are covered by Medicaid. So tribes have some great unique abilities with their sovereign status, and that's pretty great. Next slide, please.
Okay, so now we're going to get into the 3 types of enrollment options for our AIAN population with Medicaid. So what you're probably most familiar with is the fully integrated, in this case, we're talking, foster care population, so fully integrated foster care, where the person would be enrolled with Coordinated Care's Apple Health Core Connections for their medical and behavioral health services. Next up, we have the behavioral health services only option, where medical services are fee-for-service through Apple Health Medicaid using your Provider One card. But then the behavioral health services would still be provided through the managed care organization of the client's choice. And then lastly, we have fee-for-service or Apple Health without managed care, where both medical and behavioral health services are fee-for-service through Apple Health Medicaid using that Provider One card. And I'm going to turn it over to Kaiser to just briefly talk about how fostering well-being works in the care coordination for this.
Yeah, hi. So dental specifically is a fee-for-service benefit under Apple Health that Fostering Wellbeing has until recently provided the care coordination for all Apple Health Core Connection enrolled kids and Apple Health fee-for-service children and youth in out-of-home placement. But recently, Healthcare Authority made the change where dental care coordination for managed care enrollees will now be coordinated through the 5 managed care plans under EPSDT guidelines. This means for Apple Health Core Connection enrolled members or AHCC, this coordination will now be provided by them. And Fostering Wellbeing will still provide the dental coordination for the fee-for-service population. We can go to the next slide, I believe.
All right, so we're just going to talk briefly about enrolling youth in foster care into Apple Health here. So for a DCYF placement, what you're going to see normally is the information comes from the FamLink system into Provider 1 for foster care medical. And then the youth is assigned to Apple Health Core Connections unless they're categorized as American Indian Alaska Native. If they're dually enrolled or if they're non-citizen, there's a couple exceptions that direction. Okay, sorry, there's just something in the chat there to pay attention to. If DCYF, however, is getting the placement over to a tribal operated facility, that is the initial section is still going to be through FamLink, but then changes are reported on the Form 19027, and the youth would remain on foster care medical, but updates need to be done with that form. We're going to get into that here in just a moment, what that looks like. And if it is a direct tribal placement, then the tribal social worker sends that 1927 form to our HCA foster care team. And then the tribal social worker with that form is going to choose Apple Health Core Connections or fee for service, as well as the behavioral health services only option. And Jennifer, I believe that you have something to mention for those exceptions.
Yes, thank you. Can you still hear me okay?
Yep.
So when some of the exceptions that he kind of touched on, the first one I'll talk about is for our AIAN children. And so if we have when Fostering Wellbeing provides the integrated care coordination where a child is tribal affiliated or in tribal custody with tribal payment only through DCYF, and they have not been opted into managed care. So at that point, FWB would contact the tribe and ask if our services are wanted or needed. And if so, then we will request consent from the tribe to access the Medicaid data. If the youth is 13 and up, then FWB also requests consent from them, from the youth. The other exception that we have is what we call dual eligibility, and that's where the child has Medicare as primary and Medicaid as secondary payer. These cases can kind of be complicated to coordinate since Medicare doesn't always want to participate, but FWB will assist with finding providers that accept both Medicare and Medicaid so that all of the services are covered. Non-citizen is our other exception to enrollment, and they are not able to enroll in any managed care since they are not federally eligible. FWB provides all of our care coordination for this population. Thank you. Next slide.
Okay, so this is the foster care form that we mentioned. We include a direct link to it here for you. But for youth and tribal child welfare, especially without that tribal payment only case open with DCYF, the foster care team here at the Healthcare Authority really does rely on this form to know when to add youth to foster care medical. It's extremely important that this form is updated on a regular basis. If placement changes, if they want to update, anything along the managed care line, that form needs to be resubmitted to the foster care team. Next slide, please. And Raina, I believe this belongs to you.
Well, I thought it was Kaiser. Okay. So managed care options, integrated foster care, coordinated care is the managed care plan for all youth in foster care. Tribal youth in care who choose managed care will be enrolled in coordinated care. We have some great links here that I think Twyla's dropping in the chat for your use. Yep. Thank you so much. And it's interesting. So behavioral health services only. So the BHSO, a person can choose any of the 5 managed care organizations for a behavioral health service. For example, I actually just came across this where a kiddo in a rural area needed this specialty behavioral health service. So what we're able to do is keep the kiddo in the foster care, yet separate out the behavioral health service only. And that was a covered service. I think it was Molina. So when kids and families get into a situation like that, where they need a specialized behavioral health service, they can remain in their primary foster care support, yet change over the behavioral health services to a different MCO plan. And the links have been dropped into the chat for you to further research this area or access any information. Thank you.
Yeah, and I am gonna touch on that as well. Sorry, there was a confusion. We're sharing this one.
Yeah.
Yeah. So yeah, as Raina mentioned, as far as BHSO goes, because Fostering Wellbeing does the care coordination for Medicaid fee-for-service, we can also assist with children enrolled in BHSO. We can be the contact that helps if you need to switch your child into a specific provider or managed care like Molina in that instance. Or if you need to change your child from a BHSO back into fee-for-service, we can help with things like that. We can also assist with things like BHASOs and CLIPs, specifically for youth needing inpatient treatment or youth in crisis. And Fostering Wellbeing can help support caseworkers in finding a bed or other resources if needed for Apple Health fee-for-service eligible youth. And just to reiterate, even if a child is enrolled in a BHSO, we do still assist with the care coordination as far as mental health care goes. I believe we can go to the next slide. Thank you.
All right, I can kick this one off for us. So we're talking a little bit about care coordination resources. Some of this might be familiar and repetitive, a little bit of what we've been sharing today. It's very complicated with the multiple coverage options. So we just want to be very clear that all of us are here on this call to support with care coordination in some capacity as needed, or to get you connected to care coordination. I, again, am with Coordinated Care. And so our team at Apple Health Core Connections at Coordinated Care will provide care coordination for all of our members as part of their member health benefits. That now includes dental and orthodontics coordination as well, which was mentioned earlier. That was something that Fostering Wellbeing was previously providing. We will be supporting with that and making sure that whatever those dental care coordination needs are, that we're helping to make sure that that gets taken care of. And then we also have a link that will be dropped in the chat also to just kind of let folks know what are the different benefits and services that are available. And I'll talk a little bit more about that in upcoming slides as well, specific to our Apple Health Core Connections plan. Back to you, Kaiser.
Thank you. For the fee-for-service population, they can pick from any of the 5 managed care plans or remain fee-for-service for behavioral health services. Fostering Wellbeing provides integrated care coordination for all children and youth enrolled in fee-for-service, as I mentioned, including those enrolled in a BHSO. If you need assistance, we can drop the Fostering Wellbeing's referral form in the chat. And when you're using that referral form, please let us know what the child or youth's referral needs are. We can also drop our inbox email in the chat where you can send completed forms to, so we can get started with the care coordination. Additionally, you can reach us at our toll-free number, which is listed in the appendix. We know this is a lot of information and we know this can be a lot to navigate. So if you're not sure about something or you're just not sure who does what, and you don't have time to figure all this out on your own, please feel free to send us questions or any questions you may have to the Fostering Wellbeing inbox. If we aren't the correct contact, we can help sort out who the correct contact is and help connect you with whoever you need to be connected to. And next slide.
Darren, did you want to talk about the BHASO and CLIP?
Sure. So we're going to throw another acronym at you here, CLIP, the Children's Long-Term Inpatient Program. So for youth needing admission into that program, the MCOs and BHASOs provide support with that process. And we've included the link to that right here in the slide. We'll get that attached. It can be a little bit lengthy, so if you do run into any snags with that at all, need some support, Office of Tribal Affairs is here to help. As Kaiser mentioned, we're pretty much all no wrong door. If we can't get you the assistance, we will route you to the right person.
Yeah, thank you. And then we also have the Tribal Resource Hub. So the Tribal Resource Hub has been newly launched, and what they do is they are the holder of some really, really great information. For youth needing inpatient treatment or youth in crisis, the Tribal Hub can help find a bed or support with connections to other resources. So the Tribal Hub receives information and resources from tribes and providers across the state, and they kind of are a holder of information. So if somebody needs bed information on bed availability, someone needs to know who is the behavioral health contact for Colville tribes or Yakama Nation, they can also call the Tribal Resource Hub. The hub has been working on updating tribal profiles to have the latest and greatest contact information and resource information for tribes across the state. So just remember that the Tribal Resource Hub is out there, and feel free to contact them via the link, email, or phone number. Thank you. Next slide, please.
Alrighty. Hang on just a second. I'm so sorry. Got Fostering Wellbeing provides integrated care coordination for each child, and we develop a comprehensive health overview in collaboration with our clinical staff. We also encourage collaboration with the caregivers, the primary care providers, and specialists regarding your child's health information throughout the development of this comprehensive health overview. And we will continue that collaboration while your child is in out-of-home placement. These health overviews include significant history, such as your child's birth and medical history, paternal or maternal family history if it's relevant to the child's health, current medical, behavioral, mental health, cultural, and educational information is to establish a baseline for your child, and it can also be used in your court reports. The information in the health overview is pulled from billing records, and our clinical staff research medical records and consult with your child's providers to identify gaps in the child's care and also to develop a long-term follow-up plan. These can often result in referrals to specialists for additional follow-up or for community supports. We resolve benefit level, prior authorization, and prescription issues. And we can also facilitate exception to rule barriers in order to get services that may be non-covered or resolve access to care issues for your children. One example I'd like to share of FWB care coordination happened when a child changed placement and providers. FWB coordinated with Oregon Health and Science University, or OHSU, and Seattle Children's Hospital, SCH, for OHSU to continue the care via virtual appointments and consultations until the child's care had been fully transferred to SCH. So really making that warm handoff there. If you need clinical consultation, we do have 5 statewide regional medical consultants that are available to you. And next slide, please. And Kaiser, take it away.
So the regional medical consultants, or RMCs, are part-time pediatricians that are available throughout the state. And every week they send out their availability emails to their region. You can send them non-child specific or case or child specific questions or consultation requests. They'll write the at-risk letter for the adoption support caseworkers. They can review labs for interpretation, review client chart notes, and provide medical interpretation. What they don't do is provide consultation on neglect and abuse. Those cases should be referred to Seattle Children's Medical Consult Team, also known as MedCon, which DCYF and Seattle Children's Hospital have a contract to provide virtual medical consultation to DCYF and tribal workers through an online system. We have dropped additional information about MedCon and the RMCs in the chat. And that is the next slide.
All right. So kind of coming up next, we're talking a little bit more specifically now about coordinated care and that fully integrated managed care plan. And I just wanted to start by just placing us as coordinated care among the other agencies to kind of level set for where we are. So we recognize that tribes are sovereign governments, and therefore they have a government to government relationship with folks like the Healthcare Authority and with DSHS, and that coordinated care sits as a contractor to the Healthcare Authority. We obviously as ourselves are not a government, and we really respect and honor the tribe relationship as a government to our state and federal government entities as well. So we again are a contractor to a government agency. So coordinated care is one of the 5 managed care organizations, also known as an MCO in Washington, that offers free or low-cost health insurance plans to individuals and families in Washington state. We have about 200 staff that live and work in every region across the state, with one physical office that's located in Tacoma. We employ care managers, social workers, community health workers, provider network specialists, system of care liaisons, call center representatives, operations staff, marketing staff. We have a whole team of folks and more that are behind us in this work. And together we serve more than 300,000 members statewide, offering health coverage through 4 different healthcare plans shown above. That's what you're seeing here on this slide. We have the Medicaid managed care, which is what we call coordinated care. We have foster care Medicaid, which we call Apple Health Core Connections, and it's sort of a specialized version of our Medicaid managed care plan. We also have insurance that you can purchase through the Washington Health Benefit Exchange, which we call AmBetter. And then we also have Medicare Advantage, which we call WellCare. So if you hear any of those plans, Apple Health Core Connections, AmBetter, or WellCare, or coordinated care, you know that this is all coordinated care that is providing those. And today, as I kind of mentioned on this slide, we are specifically talking about one plan administered by coordinated care, and that is the Apple Health Core Connections. So when a child enters foster care through the state of Washington, they're automatically enrolled into a health plan specifically for youth in foster care, with a few exceptions, as we mentioned earlier. And that's, again, this Apple Health Core Connections plan by coordinated care. So this health plan, Apple Health Core Connections, covers about 20,000 youth across the state who are in foster care, as well as those who are in adoption support, the guardianship assistance program, or extended foster care. And it also covers young adults under until the age of 26 who aged out of foster care. And then youth who were unified with their families, and they can stay on our plan for 1 year after the case officially closes. And we also are covering a set of unaccompanied refugee minors. Again, that's a federally recognized category for these youth. So it's kind of a mix of folks that we have on our plan. And as I mentioned earlier, most of the time the Healthcare Authority automatically enrolls these youth onto our Apple Health Core Connections plan. There are various exceptions that we touched on, like having private insurance, being if parents are incarcerated. Additionally, youth who are identified as American Indian or Alaska Native, whether they're recognized by a tribe or not, do not automatically enroll in this foster care health plan, and they're entered into fee for service. Enrollment in Apple Health Core Connections is voluntary and does require proactive enrollment for our AIAN youth. All of our members, really the caregivers, given that they're mostly all kids, receive a welcome call from us within the first couple of months of joining our plan. And this call comes from our care management team, all of whom are trained in trauma-informed care and have experience working with DCYF and other governmental agencies to meet the wide range of health needs for youth. During that welcome call, our team will ask a series of questions to help identify any healthcare coordination needs, including cultural considerations, and answer any benefit questions. When youth on our plan are getting close to turning 18 years old, we'll also reach out to them to try to connect with them and empower them on how to use their health plan as they're entering adulthood. We'll ask questions to find out if there are any physical or behavioral health needs that we can help with, like finding a doctor or a therapist, as well as other social drivers of health. We ask about, their education, their housing, their employment plans, and we'll offer resources in the community to help support them as they're transitioning to independence. In addition to our care management team, we also have a health liaison in every DCYF region who can help with coordinating with Apple Health Core Connection staff, healthcare providers, or with any other issues that might arise. And the liaisons are focused on promoting really effective communication between DCYF, coordinated care, our members, caregivers, parents, and physical and behavioral health providers. They're particularly helpful when trying to understand coverage options for AIA and youth, because as we've talked about today, it's very complicated and there's multiple pathways. And then lastly, we also have a community education team that provides no-cost clinical trainings to caseworkers and caregivers on a range of topics, from trauma-informed care to self-care to supporting LGBTQIA+ youth, to understanding fentanyl and naloxone. And they also offer virtual support groups. Members, caregivers, caseworkers, providers, they can all request care coordination from our team at any time, and we can help with finding providers or coordinate care for members with multiple needs and services and help access a variety of resources, including medical supplies and community resources. Some examples of how we could support might be a premature infant who requires follow-up by a GI specialist and a neurodevelopmental specialist, and they were just court ordered to be placed with a 23-year-old aunt in OMAC, and they need to change their PCP and find new specialists. You can tag us in and we will help support with some of those needs. The minimal information that we'll need to appropriately provide support is shown here on the screen, and that's member name, the date of birth, their provider 1 number, any contact information, also their tribal affiliations or citizenship, or the child welfare jurisdiction to know whether this is a state case or a tribal case, and then any information about the need or request for support. So we can kind of use that information to get started. Additional things we might ask for would include, like, if a tribe is making the request, naming that tribe and which tribal programs, is it child welfare, is it clinic, behavioral health, directions for who to contact first. Is it the social worker, the caregiver, the nurse, the member? And we might ask for an authorization to disclose health information, and that might be needed based on the age of the member and the nature of the referral. Additionally, Coordinated Care has partnered with a few providers across the state to develop foster care centers of excellence. Foster care centers of excellence serve as an integrated and trauma-informed hub. A center of excellence can provide services to members on a one-time basis, or they can also serve as the primary care provider. They can provide specialized services for our members, including an EPSDT/well child exam, ideally within 5 days of entering care, but also no later than 30 days of entering care per our state requirements. They can provide some behavioral health services, referrals to specialists, help getting durable medical equipment, referrals to vision, prescriptions, lab tests, all those things. And our care management team works really closely with these centers of excellence to provide support in following up on those referrals and improving health outcomes for our members. And you can see on the map here where they're located. We have at least one in each of the DCYF regions, and hoping to expand into a couple more regions as well. And then we also have some value-added benefits. So these are things that you would only get through coordinated care that are not available through fee-for-service. So they're just helpful to be aware of if they're of use for our members. So on this slide, what we're seeing here is a couple of our benefits. One is the Coordinated Care Harvest Bucks. And so with this, it's a partnership with the Washington State Department of Health, as well as Safeway, to offer fruit and vegetable prescriptions throughout this state. So this is kind of our prescription program, and it provides vouchers to eligible members to buy fruits and vegetables at any Safeway store in Washington. In many program and clinic sites, participants also receive nutrition education, recipes, and social support through classes and one-on-one visits with nutritionists, social workers, health educators, and community health workers. And they receive up to about $100 worth per year for this benefit. Additionally, we also have our rewards program, which you see on there. This is a Visa prepaid card in which we reward our members for participating in healthy activities. I have some examples on the slide here where you can see that they'll get $40 on that card for annual well visits, $25 for an annual flu shot. The card is only sent the first time that the member fulfills one of those activities. So particularly for youth in foster care, if this doesn't sound familiar or you've never seen that card, it may be because as kids are moving around, that card does not go with them. So all you need to do is just give us a call or email us, and we can reissue that card to make sure that that kiddo is receiving those rewards. And then this slide just has a few extra benefits that we have as well. With coordinated care, we provide a no-cost Boys and Girls Club membership. Also, our Healthy Kids Club, so kids 12 and under can kind of learn more about nutrition and exercise. For members who might be pregnant, we have a fabulous program, our Start Smart for Your Baby program, which not only helps with education around pregnancy and delivery and postpartum care, but also some tangible items like a no-cost breast pump and a choice between a stroller, car seat, pack and play. We cover some extra things like for our members who are 21 years and older, they get $100 for glasses or contacts every other year. We have a 24-hour nurse advice line, telehealth services, and an online member account for folks. So a few of the extras that we have as well that are available through coordinated care.
Katie, I just want to break in for a minute. Oh, and you're right here. We have 4 minutes left. Perfect timing. Are there any questions? I didn't have any in the chat that I saw. Anyone present have any questions? Any of our participants?
I just have a question for you. So with behavioral health, it's a tricky thing because it's either sometimes the kids are too young for certain providers, they are not accepting anybody because they're full, and so I've actually experienced this myself that you find like a not in network provider. And they provided like a super bill at the end of each month. But my understanding is coordinated care doesn't accept the super bills to reimburse for that. And I'm just kind of trying to figure out like, how can we break a barrier down that seems to be barriers with behavioral health or mental health, because that is a hard strategy for these caregivers to find providers that is either available or will accept the age that they are. Because sometimes providers don't work with younger kids. So I guess that's kind of my question about a barrier that seems to be an ongoing barrier of how to pay privately for it, but then when you get a super bill, how can you get reimbursed for it?
Yeah, that's a tricky question. My best recommendation is to work with our care management team and have them do sort of the legwork to find that provider that does, so that way the caregiver doesn't have to keep calling around trying to find the unicorn in the area. And the ones that will take our coverage as well. You're correct. Yes, with the super bill, that is a challenge. That's not something that we're going to be able to support. We need the provider to be billing us after each visit as usual process. There may be some exceptions. I don't want to speak for DCYF. Sometimes there's exceptions for some of these pieces if we really can't find anything. But the biggest thing I would say is to contact our care management team. And I will put in the chat again what the email is for that, as well as the phone number. That's going to be your best bet. You can say, hey, this is what we're looking for. This is what we need. We'll do the research on our end to find somebody within a reasonable distance. And if it also helps us identify where there might be a resource gap, and if there's not somebody in that area, for us to connect with our contracting team to see if we can get a provider in that area.
All right. Thank you very much, Katie. We have got our closing keynote starting at 3 o'clock. And I believe the link has been put in there. And I want to thank our presenters today. You very thorough job, very comprehensive, and lots of information. I really didn't have to do much. You handled it all, and I appreciate that. There's lots of resources in the chat, and hopefully you will avail yourselves of that. I want to encourage all the presenters today to send their email addresses to Rachel or myself for a thank you token for today. And participants, please fill out the survey at the end of this session. We would appreciate your feedback. Thank you, everybody. Have a great day.